Good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikelu. First, the highlights. Federal government tracks 90 travelers arriving from high-burden countries for flouting COVID-19 protocols, warns other travelers not to endanger the country with new infections. Nigerian-born medic receives COVID-19 Community Engagement and Response Award. And outside Nigeria, India death toll from COVID-19 surpasses 300,000. Well, preventing COVID-19 is in so many ways cheaper than the cure. Well, think about it. What you spend to wear a face mask, keep your hands clean, or maintain a safe distance in closed areas is little compared to what people have gone through trying to recover from the virus, from isolation to the pain, and not forgetting the cost of healthcare, and sometimes the ultimate price, death. Yes, the daily figures aren't coming in droves, but we've been here before. It's like the calm before another wave, which might be worse. Well, to put this in proper context, take a look at how far we have come.
Activities have begun in most NYSC orientation camps across the country, and the Nigeria Center for Disease Control is advising that the compulsory camp registration should include COVID-19 testing for all Youth Corps members and camp officials while they adhere to the safety protocol. In the latest update by the NCDC, 40 new infections reported from 7 states in Nigeria have been recorded, raising the country's total number of cases beyond 166,000. Lagos had the highest figure with 29 cases, while Abia and Ogun recorded 3 cases each. 2 cases were reported from Kanu, while Kaduna, Plateau and Rivers had 1 case each. According to the agency, 0 cases were reported from Ekiti, FCT, Ondo, Osun, Oyo and Sokoto states. The latest figure has raised the overall count of infections in Nigeria to 166,019. 8 persons have been discharged in the last 24 hours after recovering from the infection, increasing the number of recoveries to 156,476. There were no deaths from COVID-19 complications in the last 24 hours, leaving the total number of casualties at 2,067. While the second phase of the vaccination exercise has commenced in some states, over 1.9 million Nigerians have received the first dose of the Oxford AstraZeneca vaccine so far. The latest update by the National Primary Healthcare Development Agency shows that Cross River, Kwara, Lagos, FCT, Ekiti, Gombe, Ogun, Rivers and Zamfara states have vaccinated more than 50% of its target population. The 74th session of the World Health Assembly, the World Health Organization's highest decision-making body, commences today. Earlier, the WHO Director General says the pandemic is far from over and the global response is at a critical phase. To address these, participants at the gathering will be brainstorming on how to urgently find innovative solutions to end the pandemic and work towards averting similar outbreak anytime soon. Globally, over 167 million cases and more than 3.4 million deaths have been reported from several countries.
Meanwhile, the federal government has declared 90 persons who arrived in Nigeria between May the 8th and 15th through the Murtala Mohammed International Airport, Lagos, and the Nnamdi Azikiwe International Airport, Abuja, as persons of interest for evading the mandatory 7-day quarantine for persons arriving from restricted countries. The Presidential Steering Committee says the travelers, 63 of them Nigerians and 27 Indians, pose a considerable danger to overall public health. They've been asked to transport themselves safely to the nearest state public health department within 48 hours of the notice for immediate evaluation and call the Port Health Services, the Federal Ministry of Health, for further directions. The PSC had on May the 1st issued new travel guidelines and restrictions for travelers coming in from India, Brazil and Turkey. Well, this latest development has gotten a lot of people worried. But let's bring you more on this and what is being done. Dr. Mukhtar Mohammed is the head technical secretariat of the Presidential Steering Committee. He joins us via Zoom from Abuja. Well, Doctor, it's great to have you. I mean, seeing this particular announcement from the PSC rightly got a lot of people concerned, wondering Have I come in contact with those people? But let's backtrack a bit. Just how did this happen?
So, good evening, viewers. Yes, we put out the notice to declare these people as persons of interest, because these are people who have visited in the last 14 days the restricted countries of either India, Brazil, or Turkey. And by our regulation, these passengers are supposed to, if they have been to these countries in the last 14 days, they should be quarantined here in Nigeria and be tested before we allow them to go out into the public. So what has happened, there were various reasons. Some of the passengers actually slipped through from the airport. They did not get to the quarantine facility. Some arrived at the quarantine facility, but maybe after spending a day or two, they also left. And some, for some unexplained reasons, we were not able to see them registered, but we know they arrived in the country. And we are also investigating how, they were able to slip through the processes and through the airport. And that is why these persons, because of the current risk that they pose to the public, that we want them to report to the public health department in the states that they are, so that they can be properly evaluated, quarantined if necessary, and also tested before we allow them to continue with their activities.
Well, so far after this particular notice was given, have you had people coming out to say, well, I'm one of those people and I'm voluntarily, putting myself back so I can be isolated or quarantined for the normal period? Have you recorded any success so far?
Yeah, this morning we've received several calls. Many people have been calling the Federal Ministry of Health to inform them that this is their location, asking for advice on what they need to do. Some of them have actually come forward in Abuja to be taken back to our quarantine facility. Now, certainly, this is meant to have a proper evaluation of these passengers and also do a risk assessment. Anyone that is found to be positive will have to be tracked to find how many people he has come into contact with. His close family members will need to be tested to ensure their own safety as well.
Well, Doctor, I'm looking at that travel advisory, which was issued on May the 1st this year. And in Part 2C, specifically says that any person who has visited those countries which you mentioned are meant to undergo 7-day mandatory quarantine in a government-approved facility at the point of entry city. Is it that this was not strictly monitored? Because you expect that if it's government-approved, then there will be proper monitoring, proper security in place. So what exactly went wrong? Is this government-approved facility, is it that they didn't have enough security? And I know we'll still talk about the role of state, but from your preliminary findings, what exactly happened?
So like I said at the beginning, there are various factors. Nigerians, there are people who actually, when they came into the country, they complied, and that is most of the people. Majority of the people have complied and they have been taken to the quarantine centers. They are currently under isolation, but there are a few who actually, when they arrived, they kind of, try to find their own way and breach the protocol. Yes, it is true that some of the security might not have been enough and tight, particularly at the airport. With flights that are arriving maybe late in the night, we understand some of them will insist that they will not stay and they will perhaps overpower some of the few security personnel that are available there. But most of them actually were taken to the quarantine facility, pretended that, they have complied, and only for them to disappear, after a few days. Without completing the mandatory 7-day period. So we're taking these serious measures, and certainly there will be a deterrent to make sure that this does not happen, because we take the priority, the health of Nigerians as a priority.
So at whose table does the buck stop really? Because like you said, this shouldn't happen again. That particular advisory says that state governments are primarily responsible for monitoring of those travelers to ensure that they adhere to the mandatory 7-day quarantine and of course repeat their COVID-19 PCR. So is this largely a failing of some state mechanism or what?
Well, there are two different things here. People who arrive from the restricted countries will be quarantined at the state of entry. That is, we're talking of where we have airports. That is Lagos, Abuja, Kano, Port Harcourt, and Enugu, which has not yet opened to international flights. But for passengers that arrive from other destinations, what they're expected to do is to isolate at home in their final destination. So people that arrive in Abuja, if you haven't been to any of these restricted countries, you will go to your final destination and then self-isolate there. That is where the role of the state governments is in ensuring that people actually do that isolation and they also test on day 7. But in this case, yes, the states also where we have these airports have a role to play, which is provision of the quarantine and supporting the security, particularly at the quarantine facilities. Most of the states, we just started now. We just started about a couple of weeks ago, and most of the states are now coming on board. Lagos State has done the most, by providing us with the long list that we have seen now, and they're taking adequate measures to ensure that they beef up security, both at the airport and also at the quarantine facilities. And just to let you know, we are still working on additional lists that will be released perhaps by tomorrow, of passengers, particularly in Abuja, who have absconded from these quarantine facilities.
I just wonder, on a final note, what are the possibilities? Because, majority of these travelers, well, a good number of them, 38, had been in India. And, of course, that Nigeria is keeping a close watch on the Indian variant of COVID-19. So what are the possibilities here? Because, we don't know where those people have been. Maybe that will be gotten from the information they give eventually when they come in. But what is the worst case scenario you're looking at here?
Well, so the worst case scenario is that somebody who is positive, who has escaped being in quarantine, would have gone to his family, interacted with them, possibly gone out to interact with other people in the community. And there is that possibility that, if he's positive, that he can transmit that infection. So what we're trying to do now is to get them back and test them. And of course, like I mentioned, there will be some deterrent measures. But first of all, our priority is to test them to ensure the safety of the people that they have come into contact with, and to initiate contact tracing where necessary, so that all people who have been in contact with them can also be monitored and tested and provided with the appropriate management, in accordance with our guidelines.
Are some airlines culpable in all of this? I know that there's a fine to be paid by airlines who maybe flout some of those guidelines in the recent one released. Is any of the airlines culpable in this?
Certainly, we have fined some of the airlines, and these are airlines that deliberately brought in people who have not presented their COVID negative results, or they have a positive result and they are, transported into Nigeria. We have identified some of these airlines, we have fined them, and we'll continue, to monitor other airlines, for such breach in protocol.
Well, Dr. Mukhtar Mohammed, it's been a pleasure speaking with you, and we wish you the very best in trying to keep this under control.
Thank you very much. I really appreciate being on your platform too.
Nigeria can produce local vaccines for COVID-19 and other infectious diseases if the federal government can urgently reactivate and strengthen medical laboratories across the country with qualified medical laboratory scientists. Well, this is coming from the Association of Medical Laboratory Scientists of Nigeria, led by its national president, Professor James Demin, at a news briefing in Abuja.
Participants wish to ensure Nigerians that medical laboratory scientists who are skilled in knowledge and techniques of vaccines production, and we are ready to start the development and production of indigenous vaccine against SARS-CoV-2 and indeed all other infectious diseases. All we need is adequate funding and necessary laboratory infrastructure. Participants resolved that strengthening the medical laboratories capacity must start with strengthening the capacity of the medical laboratory professional by exposing them to update courses, advanced training, and enabling environment to practice the profession according to the dictates of the law of the land. They therefore call on government to give premium to laboratory strengthening, especially in the primary and secondary levels of healthcare delivery. Participants were unanimous, and much as the whole world anticipate and prepare for improved response against future pandemic.
The Nigerian-born medical doctor, Njideka Udochi, has been recognized for her work on COVID-19 community engagement and response in Howard County, Maryland, USA. The award, which comes with a $65,000 grant, is her second major recognition this year. Barely 3 months ago, she was awarded the Family Physician of the Year by the Maryland Academy of Family Physicians. Her practice is well known for its diverse international patients with a multilingual workforce that boasts of 10 different languages. Dr. Udochi, who is the younger sister to WTO Director General Dr. Ngozi Okonjo-Iweala, has pledged to use the $65,000 grant to help increase access and engage children and families of Black, Indigenous, and people of color in vaccinations. Well, definitely big congratulations to her. You may have heard of a piece of PCR testing. You may also have heard about lateral flow tests and other rapid tests for COVID-19. But we might just be adding canine testing to that list with a research that has just been done showing prospects of dogs being able to sniff out COVID-19 infected people literally. But that's not the only thing happening on the foreign scene. We have joining us this evening Dr. Deji Olale, a specialist registrar in intensive care in Cambridge, for more. Well, Dr. Olale, great to have you on the program. But first, let me get your thoughts on this study that found that highly trained dogs are able to identify people infected with COVID-19 94 out of 100 times. Well, that's almost close to PCR, which is 97 out of 100. What are your thoughts?
Thank you. I was saying that it's quite interesting the way you put it, comparing the sensitivity of both tests, which is now developed canine testing and the PCR testing. I haven't read the study, paper itself, but it has a clear scientific basis. We know that canines have a highly developed sense of smell. And if you can identify that the COVID-19 virus or disease itself causes patients to emit a certain odor, I think dogs are the best animals to be able to identify it. And at 94% sensitivity, it's going to be a game changer in public places, in airports. It may actually enhance screening because the turnaround time for a PCR test as compared to the time it would take for a dog to simply sniff and maybe give a nod to say this one has got it, this one hasn't. So it's going to be a game changer. It's quite interesting. I found the news rather surprising as well. But I think COVID has been with us only about 18 months, so we'll keep discovering new things about it and better ways to approach it as well.
After all, it's the novel coronavirus. And just to add, I mean, it's not been peer-reviewed entirely. But let's talk about safety now. I mean, earlier on, the WHO says at least 115,000 healthcare workers have died from COVID-19 since the onset of the pandemic. Now, this has raised questions about the frontliners. I mean, you expect that our frontliners should be well protected. So, over a year after COVID-19, do you feel safe enough now, especially when attending to patients at the ICU? How do you feel?
Well, from my own personal experience, I feel really safe. I mean, we've survived now, say 3 waves, and the second wave was significantly at a higher peak than the first wave. In the UK, when we go back into March, April, that's essentially this time last year, there was a significant number of healthcare professionals who unfortunately, we lost to this pandemic. However, when you go into the second wave and third wave and you compare, you realize that this was not the case. And I think the difference was the PPE, which is the personal protective equipment, which were not available at the start of the pandemic. I think as time went on, manufacturers were able to upscale their production and able to meet with the logistic challenges of delivering to frontline. So I think that's what's significantly changed. Unfortunately, a lot of people have died. A lot of health workers are still dying in other countries, for instance. But in the UK, I think the significant change was the provision of PPE when it was needed and to the people on the front line where they needed it.
So 3 lockdowns, 3 waves. There are plans to open up finally June the 21st. Do you think that people can handle a 4th lockdown if maybe plans to lift the restrictions by June the 21st are derailed?
Well, I hope it definitely won't come to a 4th lockdown. I think no one would want that. As to whether people would handle it or whether they can handle it, I think that over the last 18 months, we've seen a significant shift in public orientation all over the world, not just the UK. The difference is that at the beginning, there were so many skeptics, so many people doubting the existence of the virus to begin with. And as a journalist yourself, you notice that all those skeptics have sort of died down. There's widespread public enlightenment now about the dangers of COVID. Everybody wears masks outside. In addition, there's been vaccination, which has been highly successful in the UK. Vaccination has been open in the last few days, people less than 35 years of age. When you put all that together, it seems very likely that even if we're going to have a lockdown in the future, it will be more on a regional basis, maybe in a county, on a sort of local council basis, rather than all over the country. Because I think now, with the effective track and trace systems that have been put in place, what we expect to have is that when it's noticed that there's a trend of a rise in the incidence of a particular strain, as is going in some parts of the UK now about the Indian variant, I think that what's going to happen is that that area may have a sort of mini lockdown of its own. But I don't think, given our achievements over the last year or so, that we will go into a nationwide lockdown ever again. However, I think the people are much more enlightened and educated. Right. If it has come to that, I think we will cope with it.
Well, Dr. Deji Olale, thank you so much for your time.
You're welcome.
Also staying on the foreign scene, India has crossed the 300,000 mark death toll from coronavirus, becoming the country with the 3rd highest death toll from the pandemic, behind the US and Brazil. The country has recorded 26 million cases, second only to the United States, and is now the epicenter of the global pandemic. Well, don't forget to protect yourself. The virus is still out there, so continue to take responsibility and visit our websites, channelstv.com, for more updates and a better understanding of the pandemic. We also have all the big stories from politics to business, sports, and so much more, all at your fingertips. Well, that's the COVID-19 update for today. Thank you for watching. I am Kayode Okikolu. Do stay safe.